Hi everyone, and welcome back to our channel. I'm Kim McFarland, and I'm a licensed professional counselor and a national certified counselor from the state of Michigan. Today I'm going to be talking about an important and often misunderstood topic, and it's a question that I get quite often as a dialectical behavioral therapist. I get the question is, can adolescents be diagnosed with borderline personality disorder, or what we're going to call BPD for short? If you're a parent or a young person yourself, or you're just curious about BPD in general, then this video is going to be helpful for you. First, let's take a moment to understand what is borderline personality disorder, or BPD. So BPD is a mental health condition that's characterized by intense, extreme emotions, unstable relationships, fluctuating sense of self, and these things have persisted for a very long time in several different areas of your life. But what does this mean for adolescents? So common symptoms of BPD include intense mood swings, so rapid changing in emotions, and very intense emotions, right? From one minute you're feeling happy to the next minute you're feeling sad, and maybe the next minute you're feeling super irritated. Fear of abandonment, so an intense fear of being left alone or abandoned, whether somebody is physically leaving your space or you're imagining that they're abandoning you, right? It's an imagined separation. So you might take frantic efforts to avoid either real or imagined separation. And you might engage in things or behaviors that are really extreme to minimize this fear of abandonment or to kind of latch on and hang on to somebody. Unstable relationships that are very chaotic and go between one minute you really love this person and you can't get enough of this person and you like being around this person 24/7 to I don't need this person, they're no longer good to me, I have no use for them, right? So it's idealization of people and then devaluing them, right? So from one minute you're swinging back and forth between loving them and maybe hating them or something along those lines. And impulsivity. So engaging in risky behaviors without considering consequences, right? So impulsivity can look a lot of different ways. It can be drug use, it can be binge eating, it can be excessive spending, sexual behaviors, anything that you engage in that maybe you normally wouldn't engage in unless you're under some sort of like stressors or intense emotions, or you have these urges from those intense emotions and you don't really consider the consequences of your behavior when you engage in that impulsivity. Now, you might be wondering, how can these symptoms manifest in adolescence? And can these symptoms manifest in adolescence? And the short answer to that is yes. And in fact, if you get a diagnosis, the proper diagnosis early enough, it can be extremely beneficial because you can get into the correct kind of treatment that you need. So the earlier we can identify if you're having BPD symptoms or if you're meeting criteria for BPD as an adolescent, the sooner we can get you into treatment and the sooner we can help you be much more effective. So according to the DSM, which is the Diagnostic and Statistical Manual, the personality disorder categories can be applied to children or adolescents in those relatively unusual instances in which the individual's particular maladaptive personality traits appear to be pervasive, persistent, and unlikely to be limited to a particular developmental stage. And to diagnose a personality disorder in an individual under 18 years of age, the features must have been present for at least 1 year. So what does that mean? Remember, when we're looking for things that are particularly maladaptive personality traits that are pervasive, that means it is in every part of your life. It is in all different aspects of your life. So these traits come up at home, at school, at work, wherever you are, you're having difficulty with these personality traits, right? And these traits are persistent, right? And they keep coming and they don't go away, and they're unlikely to be limited to another particular developmental stage, right? So it's outside of that normal developmental stage, meaning this is going to be much more intense, much more significant kind of impairment. So many clinicians hesitate to diagnose individuals under 18 with BPD. And that's simply because normal teenage behaviors like moodiness, impulsiveness, and risk-taking can be very typical during adolescence. However, what we would consider like a typical teen behavior doesn't tend to cause significant impairment for that young person or that adolescent. So we're really looking for behaviors that are very persistent. They continue to occur, they're in many different areas, and they cause significant impairment in some way, shape, or form for the adolescent. However, there are some important caveats before we just jump in to diagnose an adolescent under the age of 18 with BPD, right? So this is a diagnosis that, yes, you can have BPD under the age of 18, but it requires careful consideration. So some things to keep in mind is the developmental context. So adolescence is a time of significant emotional and psychological development. And many symptoms of BPD can overlap with typical teenage symptoms. And so the therapist's job is to differentiate between what's normal developmental patterns versus maladaptive developmental patterns that could lead to a potential disorder, and the duration of symptoms. So for a diagnosis in adolescence, those symptoms must be pervasive and persistent. So that means they are not just a temporary action to a life stressor or a life change. That means when everything else is relatively stable, everything else is relatively calm in their life, then this kind of behavior or these symptoms are pervasive and they are persistent, and it causes significant impairment for the young person. So then we take a look at what's called comorbidity. So does that mean I have other mental health symptoms or conditions in addition to my BPD? So that means maybe I have depression and anxiety along with BPD. So I have to have this considered every step of the way, and it's going to make it much more important for your mental health professional to conduct the proper assessments and do a thorough interview to try and tease out what is maybe symptoms of some other mental health condition versus what might actually be the BPD. So what should you do if you or someone you suspect has BPD? Seek professional help. It's important to consult with a qualified mental health professional, somebody that has experience or specializes in adolescent mental health treatment. And it's important to have open communication. And you want to create an environment of support where if you are the adolescent, you feel safe to express your feelings, and that you feel safe with your therapist. And if you're a parent, that you also feel safe and being able to express your concerns. So you want to make sure you create a supportive environment where everybody is able to talk about their emotions, their concerns, and their feelings. And you want to be able to educate yourself. So whether it's you or you're a parent or someone you know, just being able to educate yourself and understand BPD and its symptoms can help you put the right supports in place and help you get the right treatment that you need. So while there is some caveats to diagnosing someone with BPD under the age of 18, the answer is yes, you can have borderline personality disorder under the age of 18. And remember, we're looking for those persistent, pervasive symptoms that's not in response to normal life stressors and that's not part of normal developmental teenage youth. And it is going to require a careful evaluation in order to get the diagnosis by a mental health professional. If you or someone you know is struggling with BPD, or you think it might be PD, please don't hesitate to reach out. If you found this video helpful, please give it a thumbs up and subscribe for more insights into BPD and mental health. Remember, awareness and understanding are keys to supporting those who may be struggling, and we'll see you next time.